Welcome everyone to the latest VIA Live product training for our customers to learn more about new innovative products and then get a little bit more in-depth opportunities to speak to the experts in that field. But before I speak to the product, I'd like to talk a little bit about VIA Global Health. For those of you not familiar with what we do, we are a medical sourcing platform that allows you to source, quote, purchase and ship products from around the world. We list all of our products in one place and give you all of the information for product specifications, testimonials, training, and everything else that you would need. So you can see our product categories, you can shop by category, you can see some of our most innovative products here, and then you can read more about the company here and see more about what we do. But one of the main things we do offer is training. And so we like to have product webinars from time to time to explain to customers different new products that are reaching the market. And one of those products we like to feature is the non-pneumatic anti-shock garment. This is a product that's used for treating shock and in relationship with postpartum hemorrhage. And today we're very thrilled to announce that we're hosting Dr. Sheela Main, who's an expert in the field and can tell you more about the product, not just from a sales perspective, but from someone who has used it and who has trained people to use it as well. So with that, Dr. Sheela, I'd like to allow you to introduce yourself and tell the attendees more about your experience, both as a doctor, but also with the NASG.
I am a practicing obstetrician and gynecologist since almost 35 years now. And I do work in public health as well as in private sector. And as in India, we are facing problems of mortalities from postpartum hemorrhage. This anti-shock garment is a real saver. And it really helps because in some of the situations it happens that whatever best we do, still the blood and blood products are not easily available, and the patients goes into shock very soon. And then once they go into SAM, that is severely acute maternal morbidity, then it becomes very severe or a near miss situation to save them. So the fatality ratio is also high. And with 35 years of experience, I can say that there are so many modalities now to manage postpartum hemorrhage. But the anti-shock garment really comes as a timely help, because once the patient starts bleeding, until we get the proper help and the proper decision to do certain things which we need to do, it really helps us to save the time as well as it reduces the bleeding. That is the main thing, because once the patient starts bleeding and this garment is applied to the lower part of the body as well as the pelvis and the abdomen, the blood mainly from the lower extremities gets shifted to the vital organs like the brain and the heart, and the patient's blood pressure is maintained till the help arrives or till we start to take the decisions to do certain other things. And if we have to shift the patient, it's really helpful, because during the transit the patient remains stable, which is a real positive thing about this NASG garment.
Perfect, thank you very much. And for the rest of the attendees on the line, you're welcome to ask a question at any time. The easiest thing to do is just type your question into the question section, and then I can react from there. So we do have a few questions already in. I'd like to start with one where people are just asking a little bit about your background of where you have used the NASG within India.
Now in India, I am in state of Karnataka in Bangalore, which is quite a large city. And the Tamil Nadu is another state in India where they have already the anti-shock garment available with the state and Directorate of Health Services. And they have a structured in such a way that the primary health center has two, the comprehensive health center has the 4 garments, every ambulance has a garment, and even the ambulance driver also knows how to apply the garment. All the people in the state at the periphery always, and also at the comprehensive healthcare center, are trained. Now in Karnataka, we have an association of gynecology, and through this association, I have taken this initiative of training people for this NSG garment, and I have started doing this for the government doctors from Karnataka, and with the Directorate of Health Services, we have given the training to the doctors, and we are trying to spread more and more the message about this, that this can be used by not only the periphery hospitals, but also in the tertiary care center. And in Bangalore, almost all the tertiary care centers have this anti-shock garment in place. Because in my experience, when I'm working in a hospital where all other facilities are available, to be very frank, in last 1 year, I was able to save 4 mothers by applying this anti-shock garment. We have applied in other situations also, but this was the real near miss situations where we applied this garment and we could really revive the patients and save them. And we have a slogan that donate this garment in the name of your own mother, and that has clicked very nicely, and most of the senior peoples have come forward, and we have trained people and we have donated these garments to many hospitals. I have taken this initiative even at the with FOGSI, that is Federation of Obstetrics and Gynecological Societies of India, where I am the national coordinator for postpartum hemorrhage simulation workshop. And almost at every weekend there is one workshop planned, and we train people. And very happy to tell you that in certain other states also in India, like Uttar Pradesh, in Northeast, as well as in Rajasthan, particularly in district Jodhpur, the people are using it. And definitely there is a less number of deaths now due to postpartum hemorrhage after started using this garment. Getting blood and blood products is not easy. It really takes time to get the blood and blood products. Meanwhile, if we apply this garment, the patient remains in a stable condition as the blood from periphery moves to the stable or to vital organs like the heart and the brain, and the patient remains in a stable condition, and the hypovolemia meanwhile is corrected because she is not losing much blood, and definitely helps to reduce the morbidity as well as the mortality.
Excellent. Yeah, it's an excellent product because, as you said, it doesn't require that the doctor be there. It's as long as someone who is trained to apply the product is present, they can do that without waiting. And that actually leads very nicely to one of our next questions. One of our attendees has asked, so the question exactly says, when would you say is the earliest shock stage at which the garment is indicated or can be applied? So what symptoms do you see where you can begin to know that using the anti-shock garment is appropriate?
Is appropriate to use?
Yeah, so what are the symptoms where the earliest symptoms where you would know that this is the proper garment for the use?
Suppose we have a case of postpartum hemorrhage who is bleeding now, and we know that according to the classification of hemorrhage, if it is a class 1 hemorrhage, where we know that she has lost only 15% of blood, where we give the oxytocin, we arrange for 2 pins of PRBC, and we wait. Now, if the patient continues to bleed and we know that class 1 hemorrhage is going to become class 2 now, in that situation, it is very important that we know that the medical methods, whatever we are using, are not working, and the patient is bleeding, continues to bleed. Now, this class 2 can become class 3, can become class 4. In that situation, it is better we apply the garment, because once we do not know whether the class 2 will become again class 3, whether the methods, whatever we are using and medication is going to work or not. Because sometimes the atony of the uterus is so bad, or even sometimes the tears are there and which are missed, while suturing also, and the patient continues to bleed. Then it is not always that we have to wait for her to go into a hypovolemia. It is better even we can use it now. We know that this patient is bleeding and she continues to bleed, and now it is becoming class 2 hemorrhage. Better we apply it, because at any given time we do not want the class 2 hemorrhage to become class 3 or class 4, because again they require massive transfusions there. We need blood and blood products. So when I know that my patient is bleeding, I'm not able to control, yes, I do all the other methods, we will be trying, but it is better to apply the garment and do all these other techniques. Whatever we want to do for the patients, for the uterus to contract, can be combined with this by applying the anti-shock garment. Yes, the patient is in shock, there is no question. We do not have to wait for anything. We have to apply the garment, okay, and then do whatever we want to do. But even in certain conditions, when we know that the medical management is not helping, maybe it appears like prophylactic, but it is better because most of the time it happens that our women are anemic. In India, almost 50 to 60% of women are anemic. And according to the definition, even if we say that blood loss of more than 500 ml is considered as postpartum hemorrhage after a vaginal delivery, and blood loss of 1000 ml is considered as postpartum hemorrhage after a cesarean section. Now, in anemic women, even a 300 to 350 ml of blood loss is considered as postpartum hemorrhage because she cannot withstand that much of blood loss. The another two categories of women who cannot withstand again a average blood loss is because if they have a low BMI, they're small mid, and if they have preeclamptic toxemia, because there is a constricted volume in preeclamptic toxemia. Even in these women also, even if they bleed little lesser amount, they can have signs and symptoms of hypovolemia.
Excellent. Thank you very much. And I know you mentioned earlier that there was a patient you kept the anti-shock garment on for up to 24 hours. Is there a recommendation for length of time the product should be held onto the patient, or is that purely related to the patient's
See, now
current
the
status?
criteria to remove the garments are, now once we have stabilized the patient, her blood pressure is settled, her blood pressure is more than 100 systolic millimeters of mercury, her pulse is less than 100, or we can say we can calculate the shock index of the patient, and if the shock index is normal, shock index is the pulse rate divided by systolic blood pressure. Now, if it goes beyond 0.9, that means we know that the patient has hypovolemia. Now, this patient, as she was a case of placenta previa, even though we did all other methods to control the bleeding, sometimes we are worried that post-operatively also this patient can bleed because there is a bleeding from the lower segment. Now, the lower segment bleeding is not very easy to control because the lower segment cannot contract and retract. Now, it is not always necessary to keep the garment for such a long time. Now, the criteria to remove the garment are, if the patient is stable, her blood pressure is above 100 systolic, her pulse is less than 100, and she is not bleeding, that means almost 6 to 8 hours have passed. Patient's hemoglobin is at least 8 gram percentage. That means even if she had lost, we have replaced that. Patient is stable, conscious, she is not bleeding anymore, then we can think of removing this garment. The procedure for removal is we have to wait at every step. Suppose we have segment 1, we remove segment 1, we wait for 15 minutes. We check all the vitals and the parameters, that is the pulse, blood pressure. We don't find any change in the parameters, we remove the segment 2. Again, we wait for 15 minutes, check the parameters, again wait for 15 minutes, remove the third segment, again wait for 15 minutes, remove the fourth segment. Meanwhile, while removing these segments, if we find, suppose, after removal of the third segment, there are changes, the patient is developing tachycardia or there is slightly fall in the blood pressure, we have to again replace all the segments, reassess the patient whether she is still bleeding or she still needs correction of hypovolemia, and again we have to treat the patient. If there are no changes in the parameters, we have to take 15 minutes to remove each segment. Like that, we may require 1 hour, 15 minutes to 30 minutes to remove the whole garment. Now, removal is very important whenever you are applying and shifting the patient to some other center, because you have to be very sure that where the patient is going to be received, that the people know how to remove the garment, they know the importance of it. Otherwise, if it is suddenly removed, it can be a disaster.
Perfect. And there's actually a question that came in while you were speaking about that, where one of the attendees asked about the actual application of the garment and the removal. Is it applied the same direction as it's removed, or does it go in a different direction? So you mentioned starting with segment 1 to remove. When you apply the garment, is it done in the same direction from 1 through?
Yeah. The first segment applied is the first segment. Now the application takes only 1 minute if the person is trained. The patient is conscious, yeah, one person can do it. Sometimes if the patient is not conscious, yes, you may need more people because we want to do it quickly, and it hardly takes 1 minute. It starts with segment 1, then segment 2, segment 3, 4. Now fifth is the segment is the ball, which placed over the uterus, and then you apply the sixth garment. Now the segment first, second and third can be applied by 2 people, but the segment fourth, fifth and sixth need to be applied by 1 person as we have to pull it and apply it over the pelvis and over the abdomen. One thing is, when we are applying this garment, it has to be always below the level of the lower rib, because if it is not placed properly, then the patient may have some respiratory embarrassment. So after the application, the patient is conscious, we can always ask her, is there any discomfort? Is there any discomfort in breathing? And when we are applying the garment, as it is not a tourniquet, we have to see how tight it is. That is, I think you people will have access to the video. We have to hear the snap sound. If that snap sound is heard, that means the application is correct, and that much of pressure is okay when it is tied around the lower part of the body.
Excellent. And the videos referenced there are available on the VIA Global Health site for the non-pneumatic anti-shock garment product page. We have videos for training webinars. We have videos for testimonial videos as well. So you can find
Yes.
all of these additional resources there. That's excellent. And is there a maximum amount of hours that the garment can be applied, or is it all just dependent upon the patient's status?
See, like in a situation where we are working, and if we have the blood and blood products available, yes, we have to see to it that the patient becomes stable, and all those conditions which I mentioned about the pulse, blood pressure, and our hemoglobin. After that is achieved, and if the patient is not bleeding anymore, there is no need to keep the garment. But I have heard certain stories from northeast of India, which is a hilly area, where sometimes they find that it is difficult to get the blood. So they may not get enough blood products. So they get few today, then again they have to wait for some more time. In those cases, what they do not remove the garment, because they think that still the hypovolemia is not corrected. And sometimes the garment is kept there for a longer time, because if the patient is not able to get the blood and blood products immediately, in those situations, I have discussed with them, one of the professors from Northeast Medical College, that they had to keep it even more than 24 hours because the blood was not easily available. But even keeping it for a longer time also has not harmed the patient, because she can pass urine, she can even evacuate her bowel. Even if the garment is on, we can turn the patient, and she can move her legs, she can feed her baby. So there is no problem in restricting her movements in the bed at least, and the patient can be comfortable.
Excellent. So I have a few more questions here. I want to be very conscious of your time as well. But if anybody has any last questions, again, the easiest thing to do is type that into the question section of the software, and then we can ask those questions directly to Dr. Sheela. But for the meantime, we have a few more I'd like to touch on. A few people are asking what the key features or key advantages of the garment are. If you would say there's 2 or 3 of the main advantages, what would that be?
Benefits?
The benefits of using the garment.
Yeah. See, the first benefit is that it is a very helpful thing during the golden hour when the patient is bleeding. As we apply that, as soon as we find that the patient blood pressure remains maintained, the blood loss comes down from the pelvis. Very important is the blood loss comes down, and once the blood loss comes down, naturally the patient is going to remain stable. And we are buying time. Okay, even if we are in a tertiary care center and we have to shift the patient to OT, that still everything gets ready. We are buying time so that the patient remains stable, she's not losing more blood. And so first thing is that we apply that. It makes the patient stable because her blood pressure will not fall. Second, there is a reduction in the blood loss. Third, with the garment, we can do all other procedures. So the patient is bleeding less, and it becomes easier even to tackle if there are any cervical tears or vaginal tears, as the patient is not bleeding profusely, because sometimes it becomes difficult even to catch those bleeders. Third thing is, if we have to do some procedure and we have to shift her to operation theater also, we are really buying some time, because by the time the patient is prepared and shifted to OT and the anesthetist arrives, if the garment is there on the patient, it saves the blood loss and it reduces the morbidity to a great extent.
Excellent.
And
That's
as I told you that I had the opportunity to save 4 patients in the last 1 year. I think that was my greatest achievement, because I think otherwise we could have really landed up in a very bad situation.
and that's only for one person. If you can imagine that anti-shock garment finding its way throughout the country and throughout the world, if every provider can save 4 women, that's a great deal of impact. Excellent, thank you. And I know we had talked quickly about where the garment's being used within India, but have you personally been working with anyone outside of India that you can explain some of the experience you've had?
Right now there is a request coming from Bangladesh, because I was in FICOG conference Rio, and the people from Bangladesh are still not aware of it, and I think Bangladesh is also a developing country, and the fertility is very high, and again there is a need of this garment. So I think countries like FOG countries like Bangladesh and Pakistan, Nepal particularly, which is there are hilly areas there again, and terrain is really long and bad, and by the time the patient reaches the facility it takes a long time. So I think these are the certain countries where there is a real need of this garment.
Excellent, thank you. And so I don't see any other questions, so I want to finish with just one question for you. If you could describe the non-pneumatic anti-shock garment in just a few words to talk about the impact that you've seen it has had, how would you describe that in just a few words? If you can. I know it's
I can
probably a
say
challenge.
that as we call it, as a life wrap, even though it appears so simple, okay, it really gives life to mother. And imagine, a life to mother is so important for the family, because the mother is the pillar of the family. So if the mother is saved, I think the country has achieved so many things, because we know losing mother has an effect not only on the family but on everybody in the country, if we look at the economy and so many other things, and particularly her children. So it's very important that we have to save the mothers by using, even though it appears such a small thing, or this life wrap, which is so innovative and so helpful to reduce the bleeding and to save the mothers. And I really thank God that I have been introduced to this, and I am able to do something for the society by using this garment and by spreading the knowledge to see to it that people worldwide start using it to save the mothers.
Excellent, thank you. I think that's very well said. And I know you had wanted to just tell people a little bit about the conference that you are coordinating. So if you want to take the
Yes.
moment here to explain
Yeah.
what it
Yeah.
is and when it is and how
Yeah.
they can be
Then
involved.
we have an All India conference which is going to happen in Bangalore. And if you look at the slogan, we say women's health is nation's wealth. So it's so important to save the women. And I welcome all of you to this conference. It is from 8th January to 12th January at Gayatri Vihar Palace Grounds in Bangalore. You can access our website. You can go to the website, download the registration form and register. And I'm happy to share that the pioneer in this anti-shock garment, Professor Sulen Miller, is going to be our esteemed faculty in this conference. And if you come to this conference, you will get a chance to talk to her one-to-one. And if you have many more doubts, any more doubts will be clarified, and you can see even the demo there. And I, on behalf of Bangalore Society of Obstetrics and Gynecology and the Federation of Obstetrics and Gynecological Societies of India, I welcome all of you to Bangalore.
Well, thank you, Dr. Sheela Main. It's been a pleasure and a thrill to speak with you today, and I very much appreciate your time, and I thank you for joining us.
Thank you. Thank you so much.
Just to circle back now after the webinar, for all those people that ask questions about making a purchase or requesting a quote or specifications or any really product related questions, I'd like to really encourage you to visit the product page on the VIA site. What you'll be able to do is see all of the information you need, from the description of what it is, the regulatory approval provided. You'll be able to see several different pictures and graphics to explain how the product is used. some different quotes and testimonials that are associated, but then a longer description of what the product is, what it does, how it functions, any clinical research and case studies, as well as FAQs, anything regard to sizing, which has come up quite a bit. And then other videos we've had, other webinars or other product instruction or overviews. So you can find all of that here. And you can even find all the product documents. So the specification sheets and fact sheets, any of the sizing guides, brochures, anything you would really need at this point can be found here. And again, if you'd like to request a quote, you can go to the ordering information and request your quote there, or you can click just request a quote and that'll bring that up automatically. So any of those questions can be submitted directly here. If you would like to make a purchase or request a quote, that can all be done here, and our team will contact you as soon as possible. And for everyone else on the line, it's been a pleasure to have you, and we look forward to you on the next VIA Live product training webinar. Thank you very much.